Hello, we are back with the one, the only Vegas sports doc, Dr. Pinegar from Crovetti Orthopaedic. We have got to talk about recovery because recovery for the Golden Knights has not been very good. Injuries, we know the injuries. There's been a lot of injuries. We've talked about all the injuries. There's broken bones, there's surgeries, there's all these different things. This time, we want to talk about getting back on the ice, being healthy again, and why the Golden Knights are seemingly struggling to remain healthy. Why can they not stay healthy? Why can they not get these guys back and then stay healthy at that point? So to start, I'll just ask you, what would be the normal process of a player gets injured? And then what's the process to get them back? What do we need to know? What tests do we need to do? How much do we trust in the player? Like, what is that process from injured to now you're allowed to play again?
There's a lot of people and a lot of components involved. You have a team of sports medicine staff with the Knights at all times, right? You've got their athletic trainer, who's the guy running on the ice. You have a strength and conditioning coach. You have a potentially physical therapy clinic. You have the sports medicine primary care physician, the orthopedic surgeon, the specialist. There's a lot of guys involved here. So there's kind of a quarterback, your team physician's in charge. He may not even he may specialize in shoulders. He's not going to be evaluating the ankle. So you got a lot of people involved. So there's along these steps. Player gets injured, athletic trainer's first person to see him. He's at every practice. He's at every game. You have a physician in the stands at the games, but they're not at practice. And so that first evaluation occurs, and that initially from evaluation and injury standpoint up to the treatment plan, that escalates up that chain. So the athletic trainer then escalates it up to the potentially the surgeon visiting that day, or to the primary care sports medicine doctor, advances it up to the sports medicine surgeon, maybe to a specialist, goes through that process. Once that player's been determined, okay, here's the injury, here's the rehab program, let's get through this rehab program. There are special tests within these rehab programs to decide how's your strength, how's your range of motion, do you have any sensation loss? Was this a neck injury? Do you have numb fingers? Do you have shooting pain down your arm? Once they've determined the treatment program, they go through it, and you wait for those symptoms to resolve. And you're looking for percentages. I mean, no, people want to be 100%, and the likelihood of any of us, if we go on a run today, the likelihood of us having zero pain tomorrow, meaning we are tomorrow not 100%, isn't good. And so to be 100% is unrealistic in most cases. But are you at a functional percentage of play? Do you have full range of motion symmetric to your other side? Do you have full power symmetric to your other side? Can you perform your on ice drills without pain? And maybe that's not completely without pain, but without pain enough to stop you. So the player's reporting back, and I mean, you've all seen it on a football field when the athletic trainer or the coach is holding the kid's helmet. And so you're watching these guys, and you do have to take their word for it. You have to say, all right, how did it feel? And the guy's gonna be like, it was okay. And you have no idea what percent that means. Is he like, man, I barely made it through that? Or is he saying, that was simple, let's go to the next step? So there's a percentage of that that's self-reported by your player. And the trainer has his steps that he's checking, and if he says, you are still weak, then he doesn't care how you feel. You're still weak. You don't get to play until that weakness is resolved. And that goes up the chain. The athletic trainer will then say, all right, hey doc, I think this guy's ready to play. Will you check him out? Doctor checks him out, and that's either the specialist or the team physician who does the range of motion exam, does the strength exam. And then they say, okay, you're ready for like a trial. So let's put you on the ice. Let's see how you do. And so they do their skates, and a lot of injuries. I mean, we know that a lot of these guys nurse things along all season long. And when you're a highly paid professional, and when you have a commitment to try to help your team win, or maybe it's your last season and you're trying, or your last season with that contract, and you're like, I got to make myself valuable for the next one. guys don't always tell the truth.
Right.
And that's why with a concussion type injury, the coach or
Take it
the
away.
team, they take their helmet away
Yeah.
because they know that kid's going to lie right to their face. So that is the steps that get them to where they're just initially evaluated. They do their skate, they do their drills. The team's watching them. You got your athletic trainer watching them, and everybody's just trying to keep track of, like, all right, is he favoring that leg? Is he putting pressure on both sides? Is he taking a shot that looks normal, or is he favoring the shoulder? Is he holding his posture crooked? So, but a lot of it is self-reported. So there's limitations. Like when I test a person's strength, I say that's symmetric. We can put them on a machine and really get like a pound by pound test, which they
Right.
can do. But some of the sideline evaluations are just like, you know what, you feel good. And if you tell me you feel good, and if there's no risk of like long-term damage based on this, then let's give you a go.
I think inside of a game, it certainly makes a lot of sense, and I'm sure it does to everybody that's like, okay, we think this guy's banged up a little bit. He says he can go. We run some quick tests, but we've got a game. There's a literal ticking clock inside of a game. There is a ticking clock inside of a season, and we know that, like, we're midway through the season, but we also understand that we can't consistently have you're about ready to come back. The player gets out there, is just on the precipice of getting back, and then all of a sudden they're not anymore. Like with these tests, like how much do you think they're actually running these strength tests one by one and doing physical numbers, or are they probably just trusting the player saying, I'm 80%, let's get back out there? And then inevitably we get to this point and they're not 80%. I guess my question is like, do you think the Golden Knights would benefit from going more to a actual numbers based program, or continuing to, like, are they trusting the player too much is basically what I'm asking.
It sure makes you wonder. It sure makes you wonder about how much trust is the player and how honest are these players being with themselves and with their staff. It also makes you wonder, like, is there any psychological warfare they're trying to play against the other team? And like, we've got this guy, you better be ready. And then, oh,
Yeah.
here you go. So,
I would hope
um,
not. Let me just throw this out there. I would hope in the
right.
middle of January, with a goalie who has had multiple injuries, that we've been talking a lot about Hill, but there are other ones. But in this particular case, I would hope that's not the case. If we're trying to trick the Colorado Avalanche on January 10th, we've got bigger problems than this. So I would hope it's not that.
I hope not. But some of these guys, some of them know like a week in advance, like, oh, I'm not playing this Saturday. But they still say, hey, look, like we're still playing it day by day. But yeah, game time of 5 minutes before, like, yeah, that arguably in that session, and not being there, I'm putting some speculation into it. But that player had done his practices, had done his skates, had done his warm up, and been like, you know what, I'm going to be all right for tomorrow. And maybe their tactic was to play him for a period, or to play him for half, or some percentage of the game as part of his rehab. Like, here, we're going to give you a slow introduction. You're going to play part of the game, but you're not going to finish the whole game because we want to take it easy getting you back. And that morning might just be like, nope, don't have it. And so, yes, there are very very specific and accurate tests that can be done. I mean, there's range of motion devices, there's strength measurement devices, there's imaging. I mean, these guys are getting MRIs, they're getting X-rays, and they're getting assessed. And barring there not being surgical pathology, then it all is, how do you feel? How do you pass this test? But I'm sure they've got to be looking into this and finding out, like, all right, at what stage are we putting too much faith into our player, or do we need to say, hey, look, like, you have this injury, we're not going to reassess it this week, you're going to take 2 weeks, and and so we don't want to play this game like every single pregame.
Right.
Let's give you a longer period of time. But when there's a whole lot of money involved, you better believe everything gets a little crazy.
Well, that was kind of my next question, is like, all right, if we're sitting here saying, well, we feel like maybe we're trusting the players too much, they're telling us it's 80%, where really it's kind of proving out to be a little bit less than that. Is it beneficial to then say, okay, when he says 80, we've got to wait till it gets to 90? We need to, like, is it as simple as just wait longer? Like whatever we're normally expecting it to be, if we thought this was a 2-week injury, even though everything can say it's good, the range of motion test, the player can say it's good, everything says it's good, we're waiting another week. We're waiting another 10 days, whatever it happens to be. Like this is a ridiculous thing to say, but it's kind of like when you cook a steak, you have to cook it for 3 minutes and it needs to rest for 3 minutes. Well, if it's still not done, let it rest for 4 minutes or 5 minutes. Do we need to say whatever the length of the injury is, let it rest that much more, or will that not even work? Like, is that not even going to make a difference? Eventually, we've got to play.
Yeah, no, the dilemma in all of our rehabilitation protocols is that every guy's different. I mean, we get guys that have an ACL reconstruction and they are begging to come
Crazy.
back to sport at 5 months, and we're trying to hold them back. Like, that's fast. We got to protect you a little bit longer. And then we have guys at 12 months that we're like, it is time for you to suck it up and get back out there. And so the spectrum of those athletes is big, and in to further complicate, some sports have different tiers of contracts where there's guaranteed money, and then there's like money that's only assessed based on how many games you play. So you get a lot of factors on the athlete side for how motivated they might be. But yeah, I mean, there are times where we as a training staff or as a sports medicine staff literally do everything perfect, and the surgery doesn't heal and the player has to have a repeat surgery, or where they've done every protocol properly and we have no good reason why that tendon inflammation is not going away. And so there's frustration on the part of the staff when they're trying to get a guy ready. He's done every step and he's looking at you in the face and he's like, well, why do I still hurt? And you're like, don't know. Like this should have gotten better the easy way that we've already tried. Now we got to get more creative. So there sure is a spectrum of rehab, and and that's why Nolan Ryan was built to pitch and could pitch for his entire life, and other kids burn out in high school. Some of us have got different rehab and different recovery tactics, or different built-in mechanisms.
Is it possible that the tests are re-injuring them?
They shouldn't be. I mean, for these tests, they're somewhat simple. And to describe, like, the test the orthopedic surgeon does, it takes him 2 minutes. I mean, he's on the sideline, he does your range of motion, he checks your power, checks your sensation, pushes on a couple spots, and he goes, "Hey, all that feels pretty good. All right, you should like go out there and skate, see how you feel." The surgeon himself, his exams short. The athletic trainer is doing like a 1 hour session with the guy. So so there's the testing, the on ice testing is where you're trying to really prove it. The manual testing is trying to find like larger problems, the minute and the pain and the tenderness and like the reaction to being on the ice. That comes just with trial. You throw them out there on the ice and say, "Hey, well, go for it. Here's your practice jersey and see how you feel." And so there's some testing that when it hurts the person, the problem's pretty bad. But the majority of our sideline tests on a guy who's nearly returning to play, they're not picking up much.
I guess like in the end, my question would be like, can they do better with this? Is it something that if you were in charge of this and you kept seeing re-injury, can you say we can do better? Or is it at just basically like, I need to trust the players at some point, and whatever we're doing to trust the players isn't seemingly working. There's not a lot I can do unless they're more honest with me. Like, which is it? Is it we can do better, or is it we need better response? We need you to tell us what's actually going on.
I'm sure they're looking at a lot of things, because that can be, what if your physical therapist isn't as talented as you thought he was? What if your athletic trainer isn't as talented? What if your MRI imaging company didn't perform the test well? They're going to look at a bunch of things, and that's why there's turnover in these organizations when they're like, "All right, we've had too many guys hurt and they're not getting back fast. You're in charge of all these guys. You're fired. Bring
Is
in this
that
guy.
fair though? Like, is that actually fair? If you're doing the job and you're doing what you think is best, and then you get let go, like, is that even fair? Is it like, would you even be like, well, okay, yeah, I didn't do the best. Like, it seems unfair to me.
Yeah, but nothing in life is fair, you
Okay.
know?
Okay.
And so, because there's the potential to shake it up. There's the potential to say, we're not happy. I mean, like the head coach takes the fall when the team doesn't perform.
Yeah.
May or may not have been his fault,
Yeah.
but your strength and conditioning coach, he's on the hook. Your athletic trainer, he's on the hook. Your entire sports medicine physician staff can be on the hook. We see turnover, and the higher up you go, the less frequently you see the turnover, and the people on the ice. I mean, unfortunately, a lot of times we don't even know these guys' names. They're
Right.
there every single day, and they could be turning over right now. We would never even hear about it.
Yeah.
Unless the coach says, "Hey, look, like we're digging deep. We're going to work on our recovery staff," and they're going to be like, "Okay,"
Yeah.
and like so. But they've got to be looking into it. There's surveys that we have athletes fill out that try to pinpoint like what hurts, where does it hurt, when does it hurt, and you get a score, and so they've got to be reassessing. Should we use a different scoring system? Should we use a different warm-up protocol? Should we tell the strength and conditioning coach that he doesn't get 60 minutes with these guys, he gets 30 minutes with these guys? They're going to have to shake it up a little bit to find out what part of the process has become a little lax that's let people get to 2 minutes before game time and be like, yeah, never mind.
And by the way, if you're sitting at home watching all this thinking, I've been lying to myself, my hip doesn't feel good and hasn't felt good for a while, or my thigh, or whatever is wrong with you, where should they go to get that checked out?
We've got an amazing team with Crovetti Orthopaedics. We've got our new center, which is up on the corner of Alta and Hualapai in Summerlin, Queensridge Surgery Center, and our Queensridge Orthopedics office. And it's fantastic. It's new. It's beautiful.
I've been
We'd
there.
love to.
It is
You've
awesome.
been up there. There you
Yeah.
go. Good. And it's great. And we've got a great team with multiple specialists. We've got the sites. Our Henderson location, our Summerlin location, or our Queensridge location, they've both got a surgery center, office, imaging, and we've got a great team of people that love to be a part of your recovery. Try to skip some of this steps. Let's not have that game time fail. Let's make this happen.
That's right. Let's get you back to 100%. And we also hope
Exactly.
that everybody's 100%. That's the
Yeah,
goal. Thanks again. You're the
exactly.
best. Appreciate it.
Hey, thank you. Y'all have a good one.